My name's Irralee Andrzejowska. I'm a physiotherapist and SIRPA practitioner. And SIRPA stands for Stress Illness Recovery Practitioners Association. And we're a group of practitioners who work with resolving people's chronic pain using a mind-body perspective. And today I'm talking with Lorna Nicholson. Welcome, Lorna.
Thank you.
And Lorna's here to talk to us about long COVID. Is something that she's particularly interested in. So I'll go over to you, Lorna, for you to explain a little bit about who you are and your background, and then we'll go further into discussion from there, which I'm really looking forward to.
Great, thanks. So I have a background in nursing. I trained as a nurse in 1994, worked many years in accident and emergency as a sister emergency nurse practitioner, then moved into primary care and worked in a GP surgery as an advanced nurse practitioner, basically seeing whoever came through the door. So from there, I also teach Pilates. I teach people to breathe well. I'm also a SIRPA practitioner and embodied processing practitioner and a heart math trauma sensitive practitioner. So I do many things nowadays, but have a particular interest in working with long COVID, POTS, and other fatigue-associated illnesses.
That's really interesting. You've got lots of tools in your toolbox to deal with these mind-body conditions. How did you develop an interest in long COVID? What's obviously it's an interesting topic, but what was particularly about long COVID that drew you towards it?
So my own personal journey, I have a history of POTS, which is postural tachycardia syndrome, undiagnosed for many years, but then pretty much resolved my own symptoms by using a mind-body approach and understanding the source of why I had the symptoms in the first place. I set up a charity called POTS UK. And because of my interest in POTS and involvement with POTS, people started coming to me who I, on investigating and taking a bit of a history, realized that actually they had long COVID symptoms. And a number of people with long COVID are also being diagnosed with POTS and other associated conditions. So there's a massive overlap. So it's gone from there. And with my interest in breathing, people have come to me to have some breathing re-education.
Yeah, really. So it seems like it's a bit of a vague topic, long COVID, and it's very different from everybody's experience of it. So how would you describe what defines what long COVID is for someone?
It's a good question. I mean, it's come about off the back of the COVID-19 virus. And the definition is symptoms and signs that continue beyond 4 months of having the infection. Often affects women, often fit people. Symptoms are often mild. Many people haven't been hospitalized, but the symptoms persist. It has a number of other names. So long COVID is the name that has been given by the patients themselves. The NICE calls it post-COVID syndrome. In the US, it's PAX. I can't remember what it stands for. Also, long liners gets used.
What was that one, sorry?
Long liners.
Long liners, okay.
Yeah. So there's a number of names. So it's basically symptoms that have persisted after a COVID-19 infection.
And what type of symptoms might they include?
So the symptoms are really broad. Pretty much every body system could be affected by it. But I'd say the key symptoms that people talk to me about that are most troublesome are fatigue, which is really debilitating fatigue, breathlessness, fast heart rate, palpitations, memory problems, what we call brain fog. They just feel that they can't concentrate well. Muscle aches and pains, chest pain, stomach irritation, so irritable bowel type symptoms, headache, dizziness, and allergic type symptoms. They're the main symptoms. And these symptoms are very real.
Yes, and very distressing with the nature of them all, of course.
Totally.
And how does the medical profession explain the reason for these symptoms in these patients?
So a number of these patients have they've been investigated, and there are certain diagnoses that have been given to them. So one of them is POTS, which is postural tachycardia syndrome. And basically, it's under the category of orthostatic intolerance, so symptoms that occur when upright. With POTS, the marked feature is a significant rise in heart rate on being upright. For a number of people, the heart rate doesn't necessarily increase, but you get a drop in blood pressure. So that's orthostatic hypotension. A number of people have a crossover between all of them. There's also something called inappropriate sinus tachycardia, which sits under the same umbrella, which basically is a persistent fast heart rate that could be there on rest. It's not necessarily posturally associated. These have kind of been, those who had this tachycardia are after COVID, it's been referred to as post-COVID tachycardia. So that's one group. And then you get those who go on to get a diagnosis of MCAS, which is mast cell activation syndrome. So our mast cells are part of our normal body's immune response and help fight infection. They interact with the environment, and they're involved in the sort of allergic inflammatory reactions that you might get. And when they're activated, they release chemicals such as histamine, which creates the symptoms that we commonly associate with allergies. So people become very sensitive to their environment and chemicals. So some people get this sort of post-viral fatigue diagnosis, very similar to ME/CFS. And some people are told that they have what we call a breathing pattern disorder, that their breathing has just become dysregulated.
So it seems like there's lots of different types of symptoms with lots of different labels and lots of different biomedical diagnoses. But what is your belief about that? Is it all are they related to each other?
Yes, totally. I think the immune system and the autonomic nervous system are so interlinked. So one of the sort of cause that has been suggested for this whole umbrella is this autonomic dysfunction, also known as dysautonomia. And in that, it's the autonomic dysfunction as well as the immune system is not functioning properly. So the two are very much interlinked. So with the autonomic nervous system, it controls all our unseen body functions, so heart rate, blood pressure, our breathing, our bowels, sweating. So that system goes wrong, and again, the immune system, it's just not functioning as what it could do.
Yes, and I assume pain can be one of the symptoms as well that can be experienced as part of these syndromes.
It is, but pain, I would say, is not a predominant one from the people that I've come across. But interestingly, you say that a number of people I've worked with, they have a history of pain syndromes. So they've had back pain in the past, or they've had a history of fibromyalgia, or some of the other things that people have had. They've had post-viral fatigue syndrome in the past. They've had an ME diagnosis. They've always been a little bit, their heart rate's a little bit faster at times, but they don't really take much notice of it. Always been quite sensitive to their environment and allergens. Their breathing probably wasn't right, and they only look back and think, yeah, do you know, my breathing hasn't been right for years. Yes. PTSD, irritable bowel. So all of these sort of conditions are what we would call mind-body syndromes.
And what about anxiety and depression? Have they featured as well? Have you noticed?
Not necessarily.
Mm-hmm.
But interestingly, when I talk to somebody about their background, often there is a high level of childhood anxiety. Now, one of the downsides with the heart rate is people might be given a diagnosis of anxiety, which is really not helpful. But actually, when you talk to them, they are not anxious at this moment.
Or subconscious.
Yeah. And it's the way their nervous system is responding.
Yes.
So it's unhelpful when people are told, "Oh, you're just anxious."
Yes.
Well, actually, no, I'm not just anxious.
It doesn't speak to the reason. And when
No.
we look through the lens of the long COVID symptoms being because of this dysregulation of the autonomic nervous system, it makes complete sense why you can have such a variety of symptoms presenting, because the autonomic nervous system supplies every single tissue and organ and includes the immune system in the body, so it can present as dysfunction, any of those aspects.
Yeah.
And what have you noticed particularly about people who seem to be prone to the long COVID or autonomic nervous system mind-body disorders, about them as a person? Is there some sort of common traits that you notice?
Yeah, it's really interesting you asked that question. Often I show people a list of what in SIRPA we would call stress-induced personality traits. These are things like being perfectionist and conscientious, over-analytical, high expectations of themselves and others, overly responsible, need to be good or liked, self-critical, competitive, driven, dislike confrontation, need to be in control, people pleaser, and tend to be a bit of a warrior. I show this list to people who I work with long COVID, and they all say, they look at it, their face lights up, and they're like, "That's me, that explains me." And that is so consistent. And interestingly, I've spoken to a number of medical professionals who've worked with people with long COVID, and they all say the same thing. The people they've worked with were on the edge of burnout, was a term that somebody said. There was a high level of stress in their life around that time of developing symptoms. Their typical type A personality. And this is quite consistent. This is what's being noticed by medical professionals working with this people group.
Yeah, and it makes sense because, a lot of us have been exposed to COVID, but only a percentage of us have developed long COVID symptoms.
Yeah.
So obviously more in the mix than just the virus itself. It depends what nervous system that virus lands on as to how it manifests in that individual. And I think that's what has not been kind of identified in the sort of in the news or the medical literature, is that it's like they've been saying it's a mystery why some people get long COVID. It's a mystery why some people don't. But if you look at it through this lens, I'm sure you would agree, you would feel that it isn't a mystery. There's a very good explanation, scientifically backed explanation for why some people are developing these long COVID symptoms and other people shake it off.
Totally. And just coming back to the personality traits we've talked about, a lot of people say, well, that's just how I am. But is it just how you are? Ryan Hansen, who set up the embodied processing practitioner training, he has this quote: "Often these personality traits that we think we have always had, are simply trauma responses of a single series of events that happen to us that we haven't been able to move through, feel, or deal with over time." So there's a reason why we have these personality traits. And when you start making the connections, it's like, okay, that's why I need to be in control or driven or perfectionist.
Yeah, because I think people generally think that's who they are. That's what they're born with, perfectionism and being driven and non-confrontational. But with our SIRPA understanding and mind-body knowledge, we understand that these are all behaviors that have been learned. So they've been survival patterns of behavior that have helped us survive or tolerate stressful situations in our life, particularly in our childhood, which is where these personality traits are created to cope with what's going on for us, and then it becomes a pattern that we identify as being part of us. But it's good news, isn't it? Because it isn't really part of us, is it?
No. And these traits aren't necessarily bad. They become a problem when it creates pressure on ourselves.
Yes, that's right. It's a lot of self-induced stress and maybe lack of self-care, which spins out of those things. But like you say, if you're friends with or if your work colleague is a perfectionist and highly analytical and very driven, that could be really great for an employer or a colleague. But outwardly, but inwardly, it creates a lot of internal stress, which can result in symptoms. So did you want to explain a little bit more about what's going on in the nervous system, which helps people understand why these symptoms are arising and what's actually going on?
Yeah, so we'll just go back to the nervous system. So we've got our autonomic nervous system, which is in charge of all our unseen body functions. And the autonomic nervous system kind of goes into two branches. So you've got the sympathetic nervous system, which is our fight, flight, responding to perceived or real threats. I say perceived because sometimes the threat isn't there anymore, but our body is still in this fight, flight response. And then you've got another branch to the parasympathetic. Now, the vagus nerve, which is often talked about, is the nerve. It wanders around the body and is the driver for the parasympathetic nervous system. Now, the parasympathetic nervous system can be split into, has two further branches. So you've got the rest and digest, restore, repair, when everything is settled. But then it also can go into this sort of the other end, this freeze, immobility type response. So we want our system to be regulated. All of these, the parasympathetic is there for a reason, the sympathetic is there for a reason, but if we're stuck in a certain state, that can be unhelpful. I'm just going to bring up a picture, which we will just then explore this a little bit further in terms of what's going on with the nervous system. So this is the polyvagal theory. This is created by Stephen Porges, and it's quite useful to understand these nervous system states. So just thinking about this green zone, I call it the green zone. So when our social engagement zone. So this is a parasympathetic state. We're calm, connected, settled, grounded, curious, open, compassionate, mindful, in the present. We can think of this in different ways. So there's something called internal family systems therapy, created by Richard Schwartz. He talks about the 8 C's, so who we are at core. Again, it's being compassionate, calm, curious, connected, confident, courageous, creative, clear thinking. We could also think of it in terms of what we call a coherent state. So coherence is when our heart and mind and emotions are in sync, working together. And as a result, the immune system, the hormonal system, and the nervous system are working in harmony. So that's our green zone. So anything out of that, we've probably shifted our state in some way. Now, all of us in our day-to-day will go through these states. It's normal, but the question is, how much time are we spending? Can we bring ourselves back into the green zone? How sensitive are we to end up here in the fight, flight, or freeze zone? So thinking about the fight, flight, this is our react to danger. So it's an emergency. There is a threat to our life at this moment of time, and we need to respond to it. So it's there for our safety. It's meant to be there for a short time to deal with the threat. But in our society today, we're often, this threat is there constantly, even though there is no threat. And as a result, adrenaline is released, cortisol is released. So these are our stress hormones. Our heart rate is increased. So this might be partly why people get a POTS diagnosis. Our breathing becomes rapid through the mouth, lots of upper chest movements. So these are our emergency breathing muscles. Maybe this is why people get a breathing pattern disorder diagnosis. And clarity of mind is lost. Maybe this is the brain fog. So as soon as you come out of this green zone, the ability to concentrate it is lost. In the fight flight state, our muscles become tense, which might cause pain because they're ready to go and fight the whatever the threat is. You might get digestive problems. The blood is diverted away from the gut to the muscles, and which might cause some of the symptoms people might experience. And some of the feelings that come with that, this sort of panic, anxiety, worried, stressed, anger comes into it, irritation, frustration. And our nervous system just becomes oversensitive to everything. And also the immune system is affected here. So the immune system and the fight-flight system, sympathetic, is very much interlinked. And when there is this danger, our immune system gets ready to sort of heal. So it releases histamines, it releases cytokinins. Now, the thing with cytokinins is they can be inflammatory and anti-inflammatory. When the stress persists, they become inflammatory. So with long COVID, there's a lot of talk about inflammation. The body is this kind of inflammation, cytokinin storm gets mentioned a lot. There's increased histamine. So this could be why people are so sensitive to allergens and their environment, and noise and sound and so many other things. So the nervous system and immune system is so interlinked. Anything else to add on to the sympathetic, Irralee, that you want to add in?
Well, no, except that, you know, when you describe all the things there, you can see how so many people will have been in that state, and they can probably relate to that state. It's particularly with the COVID, with all the fear that was being whipped up by the media and just the talk by people around us, the isolation that was being created was enough to really fire up this sympathetic drive in people's nervous systems.
We'll come back to that. We'll just talk about the freeze, and then let's have a conversation about that, what was going on in society. So the freeze state is really interesting. Fatigue is one of the most common symptoms. And I asked people how do they describe the fatigue? What does it feel like to them? And these are some of the metaphors people come up with. Now, metaphors are kind of how the mind processes. So it gives us a lot of information when people use these metaphors. I call it powering down. Just feels like all power has been cut off. My batteries have run out and everything is too hard. Running in marsh in a lead suit. It's like wearing lead clothing with red hot needles jabbing into all my joints, and then wading through treacle. My batteries have run out and everything is too hard. That just kind of gives you this real sense of everything's powered down. And the freeze state is about this collapse, immobility, doing everything you can to conserve energy because everything's powered down. So fatigue often comes into this state. And so you can also feel helpless, depressed, numb, dissociated, just not connected with your body. Shame comes into this, shut down, hopeless, and trapped. So basically anything, when we going back to the green zone, anything that's not in the green zone, you're probably in another state. And we will be in and out of these states throughout our days. So we're never in one of these states all the time, but it's being able to bring ourselves back. Let me stop sharing this.
Something that animals experience as well, isn't it? These
yes,
survival states. It's not just a human experience, except that humans get stuck in the survival response, whereas animals move through those states.
Yeah. We've learned a lot from animals and how they respond and how we get stuck. So it'd be good to think about, well, why is all of this going on? So I was thinking about, in the SIRPA we talk about, you've got your current life stresses. What is going on in your life at this moment of time? What are your current pressures? That's going to influence. And you've got your personality traits that we've talked about. And then you've got things that have happened in your past. And all of them are going to have an influence on your nervous system. And the first thing what Irralee was started to talk about earlier was this sort of societal fear that came about with COVID. We were told March 2020, the message was put out there to go home, stay at home. And it was just a message of fear. Everybody was terrified. We just thought, if we step out our door, we're going to die. That's what was going on in our society at the time. People watched the news, they counted numbers, driving them further into fear state. We avoided each other, wearing a mask just to hide, because that's what we were told to do. Listening out for the next bit of news, the next rules that are going to change, trying to get your head around that. Massive pressure, massive stress. Many people who had COVID in the early days they really struggled with their breathing. They sought medical attention, but many should have been in hospital. They were told to stay at home. The fear of that is just incredible. And this is what we call a collective trauma. We've lived through this collective trauma. So that is going to have a massive impact on our nervous system. Anything else you want to add to that, Irralee?
No, I think you've covered that pretty clearly about, just how many influences. Everyone around us was scared, and it was because of the unknown factor, because our nervous systems don't like not knowing. And in the beginning and still throughout, there's been a lot of unknown about COVID and how it is really going to affect us. And that uncertainty has added to the fear.
Totally. So that is a massive thing to consider with why people might have developed ongoing symptoms. And when we think of trauma is quite most people would say, no, I've not had any trauma in my life, because we think of trauma as the big traumas, the really bad things that happen to people. But the definition of trauma is anything that overwhelms our ability to cope. Another definition by Peter Levine is trauma is about loss of connection to yourself, to our bodies, to our families, to others, and to the world around us. And all of us have experienced trauma in some way in our life. And the impact of childhood trauma, trauma leaves a sort of imprint in the nervous system. We can also think of that there's something called generational trauma. So while your mother was pregnant with you, your mother's nervous system state will influence you. So you might have been born with a nervous system that's already sensitive. You might have had some birth trauma, which you will not have any conscious recollection of, but that will influence your nervous system. Anything that happens in particularly the early years will influence your nervous system. But we only become conscious of our memories from the age of between 2 and 3. So things can happen that you just don't know about. So often people I work with, they say, oh yeah, I've had a really wonderful childhood, but maybe there's something from the past that is not even conscious, which might have affected the nervous system.
Yes. And then it makes sense that if we can understand what set point our nervous system's operating from, as it's operating from a sense of fear already, and then we get a new fear on top with the COVID, that's what can tip us into overwhelm and developing symptoms.
Exactly.
Equally, we can have all these traumas and experiences in life, and if they're resolved, if there's something that's that you can have resolution of them, so that you don't remain in this nervous system state, working with someone. So it's not a case that you have to change your past, but definitely have to, if you want to be free from symptoms, work through the impacts of that to change those patterns. To wrap up for the video today, Lorna, we'll need to do another video about what to do about all of this, of course. But how would you summarize? It's like we were saying, the unknown is stressful, and if we can understand and know what long COVID is about, then that informs what to do about it. So how would you summarize from what you've said are the risk factors that contribute to developing long COVID, and your understanding about it, which will then inform what we can do about it? The spoiler alert is we can do something about it.
Yeah. So this is what my observation of people who are at risk of developing long COVID. And so often people who's had a past history of one of the other mind-body symptoms that I've talked about, history of ME, CFS, fibromyalgia, chronic pain, anxiety, depression, multiple sensitivities. Those who have a number of the self-induced personality traits, those who have a high level of stress at the time of developing COVID, and also your how you responded to the COVID. Were you in fear at that time? What state was your nervous system like? Was it overloaded? And if you have unresolved trauma from childhood that hasn't been dealt with, and that may be subconscious, you might not be aware of that. So all of those factors would put you at a higher risk of developing long COVID and other associated conditions.
Yes, and I guess you come to that list because of your you noticing these trends, not just you, but other medical professions have noticed these trends, these common factors which link people together. When you view their view what they're experiencing through the state of their nervous system.
Totally.
And I notice it in terms of even how people have commented on how they've responded to receiving the vaccine. So how they responded for the first vaccine compared to maybe the second one, they can have very different experiences, and they're trying to make sense of that. But if you look at it through the lens of, well, what state was your nervous system in during the first vaccine versus the second one? And if in the moment, in that particular day when you had the vaccine, you were in a much more sympathetic or freeze state when you had the vaccine, it's going to affect your immune response to that vaccine, and therefore create different symptoms to a time when maybe you weren't as activated, for example. Did you found that as well?
Yeah, absolutely. And that starts to come on to beliefs and fear, and some of the things that could be challenged in terms of how do you manage this? What can you do to help yourself and get out of this and change your nervous system?
Well, with this great starting point of understanding it through that autonomic nervous system lens, and understanding the risk factors and common factors amongst people suffering with long COVID, we will meet again for another chat about, with this knowledge and understanding, what can therefore be done to resolve these symptoms for people.
Thank you, Irralee, and we'll have a chat next time.
Yeah, I look forward to that side of things to come. Thank you, Lorna.